The sphincter muscle of the upper part of the esophagus in the neck becomes tight and limits the passage of food, sometimes trapping it within the diverticulum, which was formed above the tight sphincter muscle. In the beginning, the symptoms are neck discomfort related to swallowing. As the size of diverticulum increases, the symptoms are more characteristic and include difficulty swallowing, regurgitation of undigested food, bad breath, cough, and even aspirational lung infections. In highly symptomatic cases, it can lead to severe malnutrition. Some patients perform their own maneuvers, sometimes unconsciously, to facilitate the passage of food, temporarily overcoming their discomfort, which often delays the diagnosis and consultation with the specialist. Originally, the only treatment was open surgery and consisted of the removal of the diverticulum and the cut of the cricopharyngeal muscle that is the main responsible for the formation of the diverticulum. In our institute, we perform the treatment of the diverticulum by endoscopic surgery without incisions. The flexible endoscope is used to cut the cricopharyngeal muscle. The diverticulum then communicates with the esophagus, allowing food and fluid to pass more easily. It can take approximately 30 minutes and is performed in the endoscopy room or operating room under general anesthesia. After the procedure, the patient stays in hospital one night. The morning after the procedure, the patient undergoes a contrast study to evaluate for improved fluid passage and that there is no leak. The patient receives nutritional guidelines to follow and quickly returns to their usual tasks. Since there are no incisions, patients require almost no pain medications. The procedure is safe and, unlike open surgery, has few side effects or complications. Complications can include bleeding and rarely perforation of the esophagus. All of these complications are handled very well in our institute. In cases where repair cannot be achieved endoscopically, surgery can be performed. Through a small incision in the neck, the esophagus can be approached and the diverticulum will be resected. In addition, the cricopharyngeal muscle incision is made to relieve pressure. If there are no complications, the patient is discharged in 2 to 3 days, also quickly returning to daily life. Not all patients benefit from the same treatment, so each patient must be carefully evaluated by our team. Our highly specialized institute offers personalized testing and evaluations to help determine how best to treat you.